my name is Kristen, and this is Jeff, the patient, and we are going to be performing a head-to-toe physical assessment. So first of all, I'm providing patient privacy. I've gathered all my equipment and have performed hand hygiene. Next, we're just going to look at the patient, his general overall appearance. He appears to have good hygiene, dressed appropriately for the situation. We're going to next look kind of at his skin. He appears pink and warm and dry. We look at the skin throughout the entire assessment, focusing on pressure points, looking for rashes, bruising, edema, lesions anywhere on the skin. Then we're going to look at his hands. I'm looking at the nails. I'll be checking capillary refill. About 2 seconds. And I'm looking at the angle of the nail. I'm looking for any clubbing. That angle looks about 160 degrees. And for all of these things, you'd want to check both hands, do everything bilaterally. His hands feel warm. Next, just looking at the patient, we're looking at his general overall mood. He appears to be alert, oriented, answers questions appropriately, calm, behavior is appropriate to the situation. He appears to hear normal voice tones, everything like that. He appears to have good nutrition, and that concludes this portion of the exam. Next, we're going to move on to the facial portion of the exam, the head and the face. So I'm going to begin by kind of palpating his scalp, feeling for any lesions, looking for any lesions, any deformities or lumps or anything. His hair doesn't feel brittle or coarse or anything like that. I'm going to be checking the temporal arteries. And they both feel equal on both sides. I'm going to be testing the temporomandibular joint, so I'm just going to have you kind of open and close your jaw. Okay, good. It feels smooth, no crepitus, any tenderness at all? No. Okay. His face looks symmetrical. There's no involuntary movements, no tics, no anything like that. And I'll be palpating the maxillary sinuses and the frontal sinuses. Any tenderness or anything?
No.
And that concludes the head and face portion of this exam. Hi, we're going to do the eye portion of the exam. So I'm going to begin with the confrontation test, and this is going to be checking the patient's peripheral vision. So I'm going to actually kind of have you turn a little bit. So I'm going to wave my fingers, and I'm going to be testing his peripheral vision, and I just want you to tell me whenever you can see my fingers, okay?
There. There. There.
Same as this side.
There. There. There.
Okay, good. You can go ahead and turn back. Alright, next I'm going to be checking the corneal light reflex. So I'm going to basically shine a light in his eye and just looking at the reflection of the light to determine that it's equal and level in both spots. Just go ahead and look at me. Okay, good. Then I'm going to go ahead and do the red reflex. So this test is going to be just checking for any opacities or anything in the eye. So I'm going to shine the light in his eye. It's going to be a little bit bright, but I'm going to do it for both eyes. Okay, good. Okay, good. is the test of the cardinal directions. So what I'm going to do is I am going to have you follow my finger, and I'm going to be kind of pausing and looking that his eyes don't have any nystagmus. I just want you to look at me, and then I'm just going to have you follow my finger. Okay, good. The next test is the cover test. So what I'm going to do is I'm going to cover each one of his eyes, and then I'm going to remove the cover, and I'm going to kind of check to see if there's any drifting or anything as I do this, and that will indicate any weakness in his eye. Okay, so just look at me. Good. Good. Next, I'm just looking at just the external structures of the eye. So I'm looking at that they're both symmetrical, no lesions, his eyes aren't protruding. The conjunctiva, his eyes look pink. The sclera look white and glossy. The corneas, I don't see any cloudiness in his iris. They're both blue. They're flat and equal and round. Then I look at the pupil size, and it appears to be about 3 centimeters or so. And then I'll go ahead and check perla, which basically means that the pupils are equal, round, and reactive to light, and that they accommodate. So I'm going to shine a light in your eyes, and I'm just looking to make sure that his pupils dilate and constrict appropriately. And then I'm going to test for accommodation. So what I'm going to do is I'm going to have you kind of look at me, and then we'll look off into a point in the distance, and then we'll look back. Okay, so go ahead and look at me, and then look up, and then go ahead and look back. Okay, good. The last portion of the eye exam would be the Snellen chart, which we don't actually have now, but the patient has reported that his vision is 20/20 in both eyes. So basically what you would do is you would post the Snellen chart, and you would have the patient stand 20 feet away, and you would cover one eye and have him read the lowest line that he could read, and you'd be watching the patient to make sure that everything matches, you know, there's no that he reads all the letters and everything correctly. The next portion of the exam is going to be the ear inspection. And so what I'm going to do is I'm just looking at the ears just in general, looking for any redness or discharge, which I don't see anything like that. So then what I'm going to go ahead and do is actually look inside his ear. And I'm looking at the tympanic membrane, and the tympanic membrane appears to have like a pearly gray color, and it looks to be intact. Is there any pain at all when I do this?
No.
Then I'm going to do the whisper test, and what we do for this is I'm going to cover one of your ears, and I'm going to whisper a word in that ear, and you repeat the word back to me.
Apple. Baseball.
Good. Then we're going to do an inspection of the nose. I'm going to change this out. So first we're going to check the patency of his nostrils. So I want you to kind of occlude one side and sniff on each side. And then once again, we're looking at the nose, just in general for symmetry, drainage, redness, thing like that. I'm going to be actually looking inside his nose. So I'm looking at the septum. It's not deviated. It appears to be light red in color. The turbinates look the same color. It looks moist. And that concludes that portion of the exam. The next portion of the exam is the mouth. And so what I'm going to do is I'm just going to look at the mouth and look at all the structures inside the mouth with the light. So go ahead and open your mouth for me. Go ahead and open a little wider. So I'm looking at the buccal mucosa. Everything looks pink and moist. You can go ahead and close. The hard palate and soft palate look to be intact. Go ahead and open one more time. Lift up your tongue for me. Okay, good. And go ahead and stick out your tongue. Okay, and the tongue looks to be midline and pink in color. He doesn't appear to be missing any teeth. His gums don't look like they're not bleeding or swollen or anything like that. Next, I'm going to look at the uvula, and so I'm going to have you go ahead and open your mouth. Go ahead and say ah. Okay, good. And so the uvula looks midline, and it raises with whenever he says that. Basically means that the cranial nerve is intact. Then I'm going to go ahead and check the gag reflex. And also, we're going to look at his tonsils. Okay, so go ahead and open your mouth. Okay, good. So he has a good gag reflex. And then we're going to go ahead and look at the tonsils. Go ahead and open one more time. And his tonsils appear to be like a 1+. They're just visible. They don't look enlarged or swollen. They're not red. And that concludes this portion of the exam. This is the neck portion of the exam. So basically I'm just looking at the neck, looking for any symmetry, again, lesions, anything like that. Palpating for any tenderness, masses, anything tender? No. Then I'm going to be looking for any pulsations, which I don't see anything, or no jugular vein distension. Next, I'm going to go ahead and palpate for the carotid arteries. And you don't want to palpate both of them at the same time. It can block blood flow to the brain. I'm just checking to make sure they're equal on both sides, which they are. Then I'm going to go ahead and auscultate the carotid arteries, listening for any bruits. Can you go ahead and hold or take a deep breath and hold it? Okay, let go. Good. And you want to check with the bell and the diaphragm. Deep breath. Next, I'm going to go ahead and palpate for lymph nodes. So I'm using 2 or 3 fingers. And you're trying to see if you feel any lymph nodes. You want to make sure that if you do feel any, that they're soft and free moving and not tender. Okay, go ahead and turn your head to one side. we don't feel any lymph nodes. Then we're going to go ahead and palpate the trachea. So we're just looking to make sure that it's midline. And then we're going to go ahead and do the thyroid exam. So I'm going to have you kind of turn a little bit to the side, if you don't mind. So I'm feeling for the cricoid cartilage. I'm just palpating the the thyroid gland for any nodules or tenderness. Go ahead and swallow for me. Good. Any tenderness? No? Okay. You can go ahead and turn back. Then we're going to go ahead and test the range of motion of the neck. So I want you to go ahead and look up and down. And then side to side. Okay, and then go ahead and try to touch your ears to your shoulder. Good. And then we're going to go ahead and try to test the muscle strength and resistance. So go ahead and push against something. Good. Good. Okay. This concludes the neck portion of the exam. The next portion of the exam is the chest and the lungs. So we're just going to inspect once again for symmetry. I'm looking at his respirations here, labored, even respiratory rate. Doesn't appear to be in any distress. Not using any accessory muscles, no intercostal muscle use or abdominal muscle use. We're going to go ahead and palpate. We palpate the front and the back, anterior and posterior, for any masses or tenderness. Good. I'm going to go ahead and have you turn kind of on your side. So we're going to check for symmetrical expansion. So I want you to take a deep breath. Okay. And so we're looking for the rise and the fall of his lungs, making sure that both sides are symmetrical, that they raise evenly, which they do. Then we're going to go ahead and percuss the lung fields. Whenever you percuss, you don't want to percuss over the rib bones. You're listening for a resonant sound. You can also percuss the lung borders by having the patient take a deep breath. Go ahead. Okay. Then you would mark that space, and then you would percuss again once the lungs have been deflated, and check for the amount of space that the lungs rise and fall. Then we're going to go ahead and do tactile fremitus. So what I'm going to do is I just want you to go ahead and say 99. 99. Good. And so you are feeling for vibrations, which I felt. And you want to test it, on both sides. So I felt it equally and bilaterally. Then we're going to go ahead and auscultate the lung fields. So every time I place my stethoscope, I want you to take a deep breath in and out, and every time I move the stethoscope. Okay? All right, deep breath. While we're on the back, I want you to go ahead and say 99. 99. Okay, good. So on the back there, just listening for the lung sounds, there weren't any wheezes or no crackles, no coarse sounds, anything like that in the back. And then whenever he says 99, you want to make sure that it is not heard clearly through the stethoscope, which it was a muffled sound. It's indistinct. You can't really notice that he's saying 99. Okay. Now I'm going to go ahead and auscultate the anterior lungs. Deep breath. Good. And that concludes this portion of the exam. Next, I'm going to go ahead and listen to the patient's heart. Now, this recording actually is inverted, so it looks backwards, but you will listen to the patient's heart. It's in the left side of the patient's chest. And so you're going to go ahead and listen to all of the valves of the heart, to the aortic, the pulmonic, the tricuspid, and the mitral. At the mitral valve, you're going to listen for the apical pulse, and you're going to count for a full minute. And his heart rate appears to be even and regular. I hear S1, S2 heart sounds. No murmurs. And I'm going to go ahead and do this again with the bell. Listening for any bruise. And that concludes that portion of the exam. This portion of the exam will be over the upper extremities. So first of all, I'm going to be feeling the radial and brachial pulses. And you would do this bilaterally, checking for equality and regularity. About 2+, which is normal. And kind of extend your arm. And then the brachial pulse. Again, you would want to do this on both sides. And this is also 2+, regular rate. Then we're going to be going ahead and testing range of motion. So we're going to go ahead and test your range of motion of your fingers. So I want you to spread them apart. So that's abducting. And go ahead and bring them back together. Adducting, good. And then I want you to flex your hands. And extend. Good. And then I want you to abduct and adduct. Okay, good. And then we're going to go ahead and test the strength too while we're here. So go ahead and try to open your fingers. Okay, good. And don't let me press down. Then we're going to go ahead and test the range of motion at the elbow. So I want you to flex and extend. Good. And I want you to hold your hands out. So this is supination, and turn them in. And that's pronation. Good. And so all of these tests you're checking, both sides to make sure everything is moving equally and there's no crepitus or anything within the movements of the joints. Okay, and then we're going to go ahead and test your shoulders. You might have to stand up for this. Go ahead and raise your arms up. Okay, so this is flexion. And then back, all the way behind, is extension. Good. And then you're going to go ahead and take your arms away from your body. Abduction. Good. And then just one arm at a time, you can bring it kind of across your body. Good. And that's adduction. Same with the other side. Good. And then we can test for internal rotation. So I want you to kind of try to scratch the back of your neck. Okay. And then reach behind your back, try to touch your scapula. Good. Same with the other side. Good. And that concludes that portion. This portion of the exam is of the abdomen. So I'm going to have you lift up your shirt for me. Okay. So we're going to begin by just looking for symmetry. It appears symmetrical, rounded. The skin appears to be pink, warm and dry. The umbilicus is inverted. If I stop and look at pulsations, you can see the pulsations of the aorta. You can see the rise and fall of his stomach with his respirations. So we're going to begin with auscultation. So I'm going to begin with the vowel sounds first. The right lower quadrant, right upper quadrant, left upper quadrant, and left lower quadrant. So you're listening for, tinkling or pinging of the vowels, and there should be sound heard every 5 to 30 seconds, which appear to be normal active. Then I'm going to go ahead and listen for vascular sounds. So I'm going to listen over the aorta, the iliac, and the femoral arteries. And I'm going to listen with both the diaphragm and the bell. Just listening for any bruits. So we're going to begin, we're going to do some light palpation and then deep palpation, feeling for any tenderness. Light palpation usually kind of gets the patient used to the feel of your hands. And then you can do deeper palpation. Any tenderness at all? You can palpate for the spleen, which you shouldn't be able to feel at all. And then you palpate on the patient's right side for the liver. Okay, and I want you to take a deep breath. Then we would go ahead and percuss the borders of the liver. So you listen for when it becomes a dull sound. And you would mark those areas, and that would be the border of the liver. And that concludes the abdominal portion. This portion of the exam is over the lower extremities. So begin by just inspecting for symmetry and for feeling for color or for warmth, dryness. These are a little bit cool. Check for capillary refill. About 3 seconds though. Hair growth, which indicates good blood flow. And then also looking for any varicose veins, which are not present. Then I'm going to go ahead and check all the pulses. We're going to be checking the popliteal pulse. You would check on both sides to determine if they're equal. They're about 2+. This is the tibial and the dorsalis pedis. Good. Now we're going to be doing range of motion. So the first is going to be the hip. So if you will go ahead and lay down. And go ahead and bring your knee up. So this is flexion of the hip. And again on the other side. Okay, good. And then go ahead and stand up. And just bring your leg back like this. Okay, again on the other side. And that's extension of the hip. Go ahead and stand forward. Then we're going to bring your leg away from your body. Abduction, and then across. Adduction, and again on the other side. Good. Okay, then we're going to test, go ahead and have a seat, the internal and external rotation. So, external and internal rotation, again on the other side. Good. Okay. And with all these tests, you're looking for smoothness of the movements. The patient is participating in active range of motion, not just passive range of motion. Then we're going to check the feet. So I want you to go ahead and point your toes. Go ahead and point your toes. Okay, and that would be extension. And go ahead and pull your feet up. And that would be flexion. And then you move your feet in. That's inversion and eversion. Good. Okay. And then we're going to test muscle resistance, muscle strength. So go ahead and try to pull up towards your face. Okay, and push down. Good. Okay. And go ahead and try to swing your leg out. Good. And back in. Good. Okay. Good. Back in. Okay, good. Okay. This is the musculoskeletal portion of the exam. So I'm going to begin by looking at all of the patient's joints, palpating them, feeling for any warmth or tenderness that would indicate like osteoarthritis or rheumatoid arthritis, any tenderness at all. And you would feel all of the joints the same. Ankles and toes. Okay, I'm going to go ahead and have you stand up. We're going to do a range of motion of the spine. So go ahead and turn this way. I want you to lean back. That's extension. And go ahead and lean forward. Try to touch your toes, and that's flexion. And while he's there, I'm going to look for scoliosis or kyphosis, which doesn't appear to have any, and you're looking for evenness of the shoulders. Okay, you can go ahead and stand back up. I'm going to have you do some deep knee bends, so go ahead and squat for me. Good. Good. We're going to test your gait, so I just want you to kind of walk back and forth in the room just for a minute. Good. Looking for steadiness, smoothness, the swinging of the hands, which is good. Okay. You can go ahead and come back to the middle. I want you to go ahead and face the camera and go ahead and stand with your palms up. And I want you to close your eyes. This is the Romberg test, so we're testing his balance, making sure that he's not getting off balance by doing this. You can go ahead and open your eyes. This portion of the exam is the neurological exam. So we're going to begin with some coordination testing. And so the first one is going to be rapid alternating movements. So what I'm going to have you do is I'm going to have you slap your thighs and then raise them up. Supine, and then back down. Okay? And you're going to keep doing that. And I want to see how fast you can do it. Okay, good. Then what we're going to do is I'm going to have you touch my finger with your finger, and then touch your nose, and then touch my finger. And we're going to keep moving spots, okay? Okay, good. Then we're going to do some sensation testing. And so I'm going to have you close your eyes. And so I'm going to do this test on different portions of his body, and I want you to tell me if you feel a sharp feeling or a soft feel. Okay?
Soft.
Good.
Sharp.
Okay.
Sharp. Soft. Sharp. Soft. 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 Sharp.
Good. Okay. Next are going to be reflexes. So the first one is the brachial radialis. And so you palpate the nerve. And so you're looking for a twitching of the thumb on the finger. You want to make sure that the patient is relaxed. Okay. Then we're doing the patellar reflexes. Okay. And the Achilles reflexes. Okay. And now we're going to do the Babinski reflex. Okay. And this concludes our exam. Do you have any questions for me?